Hi, I'm Dr. Hudson.
I'm Dr. Staub.
Today, Dr. Staub is going to demonstrate how to use a foam roller effectively on the lower back, the mid back, and the lower bottom.
All right, so today we're going to use something called a biofoam roll. You can get it at almost any Walmart, Target, sporting goods supply place, anywhere they sell yoga mats. It's usually where these are going to be. We prefer the wider one, being about 3 feet to 4 feet wide. And they're usually like a white material all the way through or something like that. We're just going to lay this down here. And the first exercise we're going to demonstrate is something called IT band stripping. And for people who don't know, the IT band is a piece of material that runs from the top of your hip to about the knee. It binds together the front and back hemispheres of the leg, and it can become problematic in runners, or people that are sitting too long, or have some kind of muscular imbalance. By stripping this out, it can help with a lot of leg and back pain. Pretty easy to do at home, only takes a couple minutes. John, how long do you think people should do this for?
Well, depending on their pain levels and the condition that we're dealing with, I would say if you could do it for a solid 30 seconds as a beginner, you're doing pretty well. Obviously, you can work your way up to a few minutes after that, but the goal is if you can do 30 straight seconds, that's good.
I'm going to start out with the beginner method, and then we'll show a more advanced method as you get stronger. The good news with this exercise is it can be done at home, costs relatively very little to get the equipment you need, and once you're started, it gets easier and easier. First couple times doing it, beware, it might be a little painful. So there's cheater ways of doing it. When you get on your side, you're going to position yourself like this. The leg that's down, you're going to try to keep as straight as possible, and you're going to keep your back straight while you're doing it, which will engage your core muscles. You can plank up from the side to take weight off if it's hurting you, which will not only make the exercise easier, but also strengthen your obliques. So once I start at my hip, I'm just going to walk myself slowly upward towards my knee, keeping my body straight. Breathing as I go. Don't forget to breathe. A lot of people will hold their breath. That's not a good thing. And then I go slowly back down again. And I kind of work that over and over. If you feel a knot and it hurts, the thing I like to tell my patients is if it hurts, you need it. It's kind of like telling your dentist, well, it hurts when I brush and my gums bleed. The dentist would say, well, you need to do it more. Same thing goes with this. So that's the easy beginner method. And as I said, don't be afraid to take your weight off if you need to. The second method is a little more advanced. You're going to fly your legs out, keep your body straight, and you're going to use your upper body strength to pull yourself slowly along up to the knee and then back down to the hip again. Any pointers there, Sean? Any cautions?
The only caution that I would say is if you have had any surgical repairs, whether it be hip replacement, hip surgery, knee surgery, you want to consult your surgeon or at least one of us to confirm that it is okay to perform these exercises. We're assuming in the scenario that all of the joints are your own.
Second exercise I'm going to show, I'm going to turn it just a little bit to make it a little easier. I'll get us on a oblique. Is an exercise that's excellent for stripping out your glutes, especially people with sciatica. We're usually going to see two tissues that are involved with that, piriformis and IT band, so you'll want to do both. So this piriformis stripping exercise, we're going to use the same equipment. And at first I'll just sit on the roll, get my balance and kind of lay of the roll. Then I'm going to cross my leg over, just like you would if you're sitting. I lean back and tripod back onto my same hand that I'm trying to strip the glute. So right now I'm trying to strip my left glute, and in doing so, I got about 90% of my weight onto this butt cheek, and I'm going to find my knot and just slowly try to knead into it with the roll. Less is more with this. You really don't want to move a whole lot. If you feel like you're falling backward off the roll, you're probably doing it right. But you'll definitely know when you hit the spot, you'll feel like, ow, that's it. And I always tell people, don't be afraid to get in there. And you'll probably take a good 30 seconds to a minute, maybe 2. If you do this regularly, it will really help. Sean?
Be aware that the sciatic nerve runs under this, this region, obviously through this glute and piriformis muscle. If you have a history of sciatica, don't be surprised if you become aware of it. That's the idea here, is to loosen these soft tissues up and release that nerve.
That's pretty much it. So we just showed you release for piriformis and IT band. Thank you so much.
Thanks.